Good morning. At least it is for me. I'm my last full day here in Cabo. Sorry for the casual dress, but I am on vacation, so I'll give myself a break. Frequently, I'll probably come from my office and be a little bit more clinical attire, but right now, I think a t-shirt works fine. Well, it's time to get started. And I'm never gonna teach you guys things or talk about things without discussing why. That's always going to be part of what we do. And I guess the big why on this one we sort of covered in my introductions, trying to convince you guys to listen to me. It's to add more health to your years and more years to your life so that you can do the things that you love to do for longer and contribute more to the lives of others. But why am I going to talk about what we're going to spend most of the time talking about today, which is the blood vessels? Well, because at the end of the day, it's the blood vessels that cause most of our issues. The decline in our health is from decline in our organ function, and our organ function is extremely dependent upon blood flow to the very tissues that make up those organs. And obviously, it's our blood vessels that carry the blood, the nutrients, the oxygen to those target organs. So my goal for you, as I explained, we're talking about fighting chronic disease, and a big component of chronic disease is the disease of the blood vessels. And in order to understand how to fight chronic disease, you really need to understand chronic disease better. So that's the why. My goal will be for you to understand exactly a little bit better understanding of what like a heart attack and a stroke is when we're done, but more importantly, the processes that are in play that lead to the problems in the blood vessels that cause those things. So let's see how I do. I pray for wisdom from God to help me provide this information in a way that you can understand. All right, so I told you that we would define cardiovascular disease as one of the chief chronic diseases, and I think I told you in my initial outline the two biggies are coronary artery disease. Coronary means of the heart. So the coronary arteries are the arteries that actually feed the heart muscle. The first thing the heart does when it pumps blood out of the chamber, the left ventricle, into the aorta, there's three big blood vessels that come off of the aorta right above the heart, and they go and feed the heart muscle itself, because as an organ, it needs blood flow. These blood vessels can become clogged with what we would call plaque, or atherosclerosis is the term that we use, hardening of the arteries, and that plaque can be soft or calcified, as we'll talk about when we get in much greater depth when we start to talk about how we evaluate whether you're developing any of this issue or not at whatever age you're at. A second big component of cardiovascular disease is disease of the cerebrovascular arteries. Those are, cerebro is head. So those are the arteries in the brain. And those vessels can become clogged with this process of atherosclerosis, or hardening of the arteries, and it can cause strokes. And then we have to realize that this is not just happening in these big arteries that I'm speaking of, but it's also happening in the tiny blood vessels, what we call arterioles. So the arterial system, the system that delivers blood to the organs from the heart, different than the system that carries blood back to the heart, the venous system, is a branching tree, right? It starts out with the largest artery in the body, the aorta, and it branches down to tiny arterioles that are not even named. And at the very end, we get to the capillaries, which are the tiniest blood vessels in the body that actually deliver the blood which has nutrients and oxygen across the membrane from one cell to another, the target organ. So we need to go to this little diagram, and just give me a moment here because I'm going to pull it up so I can speak to you about it, and we'll share it with you guys. All right, so this diagram is pretty well done diagram that sort of shows the progression of what happens inside the arteries as we develop this process of atherosclerosis. And as you can see, the artery is a muscular walled chamber, and it has a single cell lining, which we call the endothelium, something that you will see we study. Its function in you, because it's important, that those cells do more than just line the blood vessels. They are extremely metabolically active cells. They produce things that make our blood vessels work properly. So what we see as we move down the artery is the beginning insult is inflammation. And this diagram shows you some of the things that cause that inflammation, but we're not going to dig deep into that yet. But I just want you to understand the process. So we have this inflammation, and it starts to cause the junctions between the cells to become leaky, okay? And then we have particles known as cholesterol particles. The big actors that we all think of is the low-density lipoprotein. These are small, dense particles of fat that can penetrate the wall of the artery and start to build up behind the artery as you see the progression from the left side to the right side in the diagram. Now, white blood cells, a particular class of cells known as macrophages, are involved in this, and they allow us to do some surveillance as well that we'll talk about, because we can measure if that activity is going on, where these macrophages come into the area and gobble up the LDL particles behind the arterial wall. At any rate, as time progresses and we allow more and more of these small, dense cholesterol particles to penetrate this inflamed wall, we see a thickening of the wall and a narrowing of the channel. And as that happens, we get less delivery of important nutrients to the cells of the body. Now, it turns out that there's another factor that ties into how readily these small cholesterol particles penetrate the wall. I mean, there's many factors, obviously, and genetics are a huge one, but sugar seems to increase the speed at which those little particles get in there behind the wall. As we progress along, we see the wall thicken to the point where the channel can be so narrow that very little blood flow is getting through. In a situation in the heart, for example, this might be a time when a person develops a condition called angina. So that means they have a fixed narrowing of the blood vessel that's so small that not enough blood can get through, so that when they demonstrate enough exertion and put enough demand on the heart muscle, the muscle doesn't get adequate flow and it starts to have pain. It's not actually dying. It's a lot like how your legs might feel if you push them really hard in exercise, right? You start to get some discomfort. That's angina. But if we go all the way to the right, we see this episode where there's an actual break in the wall, and we see this little blood clot start to form. Now, we call that a thrombus, a blood clot within the artery. And when this happens, if it blocks off the entire channel, which commonly it will, what we see is death of whatever tissue is downstream of that. And generally, if it stays blocked off long enough, that's irreversible death. Now, the big ones, and these get most of us, this is the number one cause of death in the United States. These two things will get most people. If it happens in a coronary artery, you have a heart attack. The medical word for that term is myocardial infarction. If it happens in a cerebral artery, one in the brain, you have a cerebrovascular accident, what we call a stroke. Now, there are ways to impact this progression along its entirety. Now, number one, we're going to talk about natural ways to do this. And obviously, there are ways that we can reduce inflammation. It's going to be a big part of what we talk about. There's ways that we can affect our lipid panel, the number of those small, dense cholesterol particles, or improve the number of the protective ones, which we will talk about. We can keep our sugars lower through various mechanisms. We can make our body less likely to clot through healthy mechanisms as well. And then medicine has a number of ways to impact this progression. Obviously, we have medication that can lower your cholesterol. We have medication that can prevent your blood from being so sticky so you're less likely to clot. And then we have interventions. If you have a heart attack, we're very fortunate in that those arteries are large enough and we have the technology to do things called stents. Now, a stent is when a physician would go in with a long catheter. Nowadays, we can do it in the wrist, put it in the radial artery, run it up into the heart, squirt dye, see where the blockage is, suck the clot out, and then use tools to open the artery back up, put a kind of a spring coil in there that keeps the artery open. So we're very fortunate that we have this amazing technology, but the goal is to not utilize it. At least that's my goal for you. We don't so much have that level of technology happening yet at the cerebrovascular level, except at the very large arteries. We can give medicines that we just infuse into the body, called thrombolytics, that can sometimes reduce the risk of complete tissue death by opening the artery back up by dissolving the clot. However, they cause much thinning of the blood and therefore expose you to risk of bleeding at other sites. So that's kind of a synopsis of macrovascular disease of the big blood vessels, the progression, and to review the three things that I want you to really take away from this, other than an understanding, hopefully a little better, of what a heart attack and a stroke is and maybe what some of the approaches might be if that were to occur, and you had one of these events, unfortunately. I want you to really, really focus on three things that we're going to start to talk about as we progress to the causative effects driving this, which is glycation, elevated blood sugar, dyslipidemia, which is the technical term for a poor blood fat panel, too many small dense cholesterol particles, and inflammation. We're going to spend a lot of time talking about the root cause of all those things, but not before we move on to high blood pressure, cancer, diabetes, dementia, obesity, autoimmune disorders, chronic obstructive pulmonary disease, kidney disease, frailty, and just define those things a little bit better. And then we'll move back to the blood vessels and this process. And you're going to see that everything is so linked together. You can't treat one without treating the other, and they all seem to drive one another. Hopefully, when I'm through talking about chronic disease, you'll have a greater understanding, and then we'll be able to talk about how to fix it. So, I really appreciate you spending time with me. I hope it wasn't too long and tedious. Hope you gained a little bit of information. We're learning about the enemy. Let's keep those blood vessels healthy. Thanks for joining me.